afternoon, colleagues. Good afternoon, Jamaicans listening on radio, on television, on the internet, Jamaicans at home and abroad. The government of Jamaica completed its deliberations at Cabinet today, and we have, as we have committed to, we are now providing you with the positions and decisions taken as a result of those deliberations. But before I do so, let me give you some insight into how the government is evolving its management of this crisis. We have now established, as I indicated at the last press briefing, a core unit of cabinet that will focus on the detailed review and deliberations of the inter-ministerial events and decisions that have to be made. And that smaller group of the cabinet met yesterday. The ministers who participated wants the public to know that they started at 9:30 and went straight through till 5:30. It was a very productive meeting, and a part of the success of that meeting is that I'm able to stand there at exactly 5 p.m. as we have said we would to the press. So in changing the way in which we have managed the decision-making around this epidemic, we are better able to manage time, but also better able to spend quality time on truly thrashing out all the details of the decisions that have to be made. That group, which is really interministerial and focuses on areas that are not adequately covered by one particular ministry, that group is charged with working very closely together in ensuring that those functions that are not in the remit of a particular ministry, that there are no slips in implementation. Because the truth is, as all the ministers have agreed, that whilst we spend a significant amount of time deliberating, analyzing, receiving reports, when it comes to implementation, that is where the gap could be. And therefore, we need to be spending time not only at the policy level to get the policy correct, but we need to ensure that we are reviewing and giving monitoring and evaluation to the implementing arms, making sure that any bureaucratic obstacles, that those are removed, and that if there are things on the horizon which would not come to our attention by virtue of us sitting down in office and reviewing information, things like ensuring that we get reports from the field on a regular basis and match those to other information that is happening elsewhere in the world, so that we have a comprehensive policy-making, decision-making, and implementation strategy. And I believe that what we have done now has improved that and will ensure that we have no slips in the management of this crisis. Of course, I'd said it before and we'll say it again, that the greatest threat right now to where we are in the stage of the epidemic is those persons who have come into the island since the 18th to the 24th and who have not yet reported through the various channels provided by the Ministry of Health. Those persons continue to pose a public health risk. Persons who entered Jamaica on or after March 18, 2020 continue to pose an extremely high threat to the health and lives of all Jamaicans in relation to the transmission of COVID-19. We expect all relevant persons to obey the direction given to report to the Ministry of Health and Wellness But we know that not everyone has reported to date. The government is making every effort to ensure that the list of persons who have not reported to the Ministry of Health is accurate. We are also intensifying efforts through door-to-door searches for persons who came into the island on or after the 18th of March 2020 and who have not yet reported to the Ministry of Health and Wellness. Persons who are required to be in quarantine at home, but who have not done so as required, including for the entire 14-day duration, will be taken into state quarantine facilities and will also be charged. All non-compliant persons are therefore put on notice that the government is moving to charge them under Section 52 of the Disaster Risk Management Act for failing to comply with a direction given or requirement imposed by an authorized officer to regulate your movement within or around the island, pursuant to the Disaster Risk Management Enforcement Measures Number 2, Order 2020. We will remind all persons that the government already has a list of all persons who entered the island, that is the aircraft manifest. Those who have not yet reported to the Ministry of Health and Wellness will be put on a watch list to be used by PICA to stop any attempted travel, and for PICA to also notify the security force and the health authorities to charge them and put them in state quarantine. The Ministry of Health and Wellness will advise PICA about who remains on the list or who is removed from the list as persons report in from time to time. Now, I've said all of this in legal language. Let me say it so that the average person can understand what will now happen. Last week, we gave a direction to the Ministry of Health and the police force to work together with PICA and Custom to establish a list of persons who came into the island on or after the 18th of March, and that list is a comprehensive list, as comprehensive as we could get: name, passport number, and address. That list is then matched against those persons who have contacted the Ministry of Health, either through the telephone numbers which have been given, the email address which has been given, or the Jam COVID website. And we are now examining the records at the local health authorities in the various regions, because persons may have called in to those regions as well. And once we collate that, which we are now in the process of doing, we will take those persons off the list that we have of persons coming into the island. So now we will have a net list. So the list that we will have as of Sunday will be the list of persons who have not reported. The police, along with the Ministry of Health, will be going door to door. In fact, they have already started since last week to find such persons. Now, there are those who might say, well, they can't find me because I gave a wrong address. They can't find me because even though I gave the right address, that's not where I am. Granted, we may not be able to find you, but you will not be able to leave the island. And we will tighten our dragnet to find you. There is a real risk, and I will speak to that later. persons who have not reported are at this point, and from the time they have not reported, in violation of the order that requires them to report. And violation of the law, that is the Disaster Risk Management Act, can result in a fine of up to $1 million and imprisonment or imprisonment. We will now, as we find persons, as we discover them, charge them. And we will also, where required or as necessary, place them into state quarantine. Why is it that we have to take it so seriously? The Minister of Health will back me up when he comes up to speak, which I'll invite him shortly. That most of the cases that have come in, most of the cases that we are seeing now are cases that have come into the island during the period that I have mentioned. That is between the 18th of March and the 24th. And the other cases are related to them. So the potential for spread and exponential spread is now directly related to that population that came into the island. Now, it is not all bad news. We have a record of 460 persons who have called in to the Ministry of Health. That number may grow as we search through the other databases. And I want to thank those people who exercise their good conscience, their good judgment, a high sense of patriotism, a high concern for individuals themselves and others, done their civic duty. They have isolated, stayed at home by themselves. They have sent home their home staff or other family members, sent them away. And they have reported their situation to the Ministry of Health. The Ministry of Health tells me that there are persons who call religiously to say, here is how I'm doing, this is what has happened. And in fact, we have, for example, someone who came back from the farm work program. He came back during the period of time that I mentioned, the 18th to the 24th. He fell ill, but he self-isolated. He placed himself under quarantine. He called into the Ministry of Health. And I want to congratulate him specifically. And there is the couple, I won't say which parish, but an elderly couple who came in from the UK. And they recognized what was happening. They sent home their household staff, sent away family members. They called in to the Ministry of Health. That is what we want to see our Jamaicans do. It pains my heart to having to read this, that we are going to have to go door to door to find, to literally pull resources from other areas which they are needed to do this. When all it requires is a simple phone call to 888-1-LOVE or to go online to jamcovid19.moh.gov.jm and fill in the simple form. Why is it that we need to know? Jamaica has done fairly well, but all of that is in threat because the process behind keeping the curve flat is that the Ministry of Health has deployed an expert team of public health officials to do contact tracing. Now, to do contact tracing, you must first know the contact, the index. Who is the person that has the infection? And immediately identify who that person came into contact with. And once we are able to do that, then we can put in place strategies to contain. So, in the first instance, Minister of Health, We found an index case, March 10th. Person was in Bull Bay. Came to our attention. We went and investigated, asked questions, found out who that person came into contact with, and then we took some decisions for the public health, which is to quarantine the area. When we quarantined the area, everybody was quarreling with us. They're depriving people of their freedom and ability to move around. But now I think we can say we have largely brought that situation under control. People appreciate that that was in the interest of the public health. If everyone acts responsibly, we can keep our curve low. The question is going to come, Prime Minister, why not publish the names? Well, I believe we have already said it. The Minister of Health said it in Parliament, in the Parliamentary Committee yesterday. Though this is an emergency, we have to comply with what is within the law. We have to make sure that we follow the process. My own view is that at some point in time, we will have to publish the names. But at this stage, we're going to go through the process. We're going to try and identify them. We're going to exhaust all the options available to us to find those persons. And I believe that we have started to escalate the situation to ensure compliance. So at this point, I'm going to invite the Minister of Health to give a presentation.
Thank you very much, Prime Minister. So let me begin by just echoing the sentiments of the Prime Minister in terms of the need for that 5,000 plus, well, it's now about 4,500 or thereabouts, to declare themselves. The method of testing which we have engaged, and the Chief Medical Officer perhaps will elaborate on that, gives us a fair degree of confidence that we have managed to isolate, if you will, cases that have been imported. We have been able to trace and test cases that are linked to those imported cases. And indeed, beyond that, we have tested persons who are unrelated but being affected by the same symptoms, flu-like symptoms, and who have been hospitalized, and use that group as a control group to determine if there are other types of spread in the wider population. And the results so far has given us cause to be optimistic that the main source of spread would be persons who came in most recently. And so the Prime Minister is absolutely correct, based on the work that has been done on the ground and the advice given, that 5,000 or thereabouts population is absolutely critical. And I just want to say what we want to do is to help them. We want to help them to help themselves, and of course, by extension, to help the community, family, and by extension, the country. Just to give a quick update on where we are currently. So Jamaica has now recorded its 53rd confirmed case of COVID-19. This follows 6 new additions over the last 48 hours. The new cases are a 58-year-old male from Manchester, who is a contact of a confirmed case. A 57-year-old male from Kingston and St. Andrew is a contact of a confirmed case. A 40-year-old male from Kingston and St. Andrew, whose mode of transmission is currently under investigation. A 23-year-old male from Clarendon, who is a contact of a confirmed case. A 42-year-old male from Clarendon who has a travel history to the US, and a 22-year-old female from Clarendon who is a contact of a confirmed case. Currently, and on the positive side, 5 persons have been released over the last 48 hours following their recovery from COVID-19, which brings the total numbers released to 7 to date. So 7 persons who have gone through the process, been isolated, been treated, have been released. And I actually visited with the 3 released today. Yes, I did. At the University Hospital of the West Indies with the medical team, including patient 1, This is the first case that was discovered. They are fully recovered, and that discussion was quite instructive. It was to discern from them the conditions of treatment, how satisfied they were, what suggestions they would make, because we're going through a learning curve, given that this is the first time we're going through this. The report was generally very positive. They were very pleased with the medical staff, with the attention they got, and I want to just really, again, place on record our appreciation for their efforts. And they are better based on the 2 negative tests within the 48-hour period. So they are now going to take their rightful place back in their communities. In the case of patient 1, she will await a little while before she goes back to the UK, and they have asked to express appreciation, Prime Minister, to you, to the government, and to the healthcare system for the support. The message in all of this is that we really still have the issue of discrimination. And one of the messages that we were hoping to telecast using them and us is that when they go back in their communities, please treat them the very same way you would have treated them prior to them having this disease. This disease can be treated, persons can recover, and the vast majority of Jamaicans, as is the case in the world, will recover from it. The 25 persons are in quarantine, 59 are currently in isolation. We have now tested 540 samples, including the samples that were tested for severe acute respiratory infections, and the 53 confirmed positives, 484 negatives, and 3 pending. That's a positive rate of approximately 10%. And the tests have included 20 doctors, 25 nurses, and 6 support staff, with 1 nurse, 1 healthcare professional having a positive test. Our healthcare workers are also a critical part of the testing mechanism, and that is to ensure that their safety is guaranteed. We spoke some time ago about the mobile testing to expand the cadre of testing or the collection of samples. We had hoped to roll those out this weekend. I believe we're pushing back until Monday because we are retrofitting the vehicles to put those out. So at another time, we'll discuss that. I'll allow the Prime Minister to speak about the community quarantine and quarantine piece in particular, because there are some additional developments there. But just to remind Jamaicans that home quarantining remains an important part of the process, and we encourage persons to serve their 14 days and to call the 888 One Love number. Thank you.
Thank you, Minister Tufton. The government of Jamaica will extend the period of closure of our borders to incoming passenger traffic. We continue to refine protocols for the eventual controlled entry of Jamaicans. And I know that when I say this, I'm going to get hundreds, if not thousands, of emails, which I will forward to the Minister of Foreign Affairs, on top of our hundreds of thousands of emails already, to ask when and how and so forth. I get quite a bit of emails and calls, and many of the stories are stories worth considering. However, at this stage, we have to look at what is in the national interest, the public's interest, and even in the interest of those who have to shelter in place overseas. So we are not at the stage where we are able to return to normal. And here, may I hasten to say that when we come out of the COVID epidemic, we have to get used to what we call a new normal, meaning that there would have to be new measures in place to control entry into the island. Regrettably, as I said before, the majority of nationals who came into the island on or after the 18th of March have failed to report to the Ministry of Health. So we have very limited knowledge as to the spread of the disease within that group and how many persons in that group are actually at risk, and those who are at risk of contact with them. We have seen where countries that have allowed mass entry of their nationals and others into their country, having come out of the peak of the epidemic, we're starting to see that their numbers are rising, and they now have to be putting in place control measures for entry. The other consideration is that the countries from which we would get most of our nationals seeking to return home are countries with community spread, but not just community spread, they have exponential rise in their community spread. And therefore, we have to be very concerned about that. So for these and other reasons, we have to keep our borders closed. So we will extend it for a further 14 days. We will review and then make a decision after that. But we also have to consider what protocols we need to put in place to prepare us for what the new normal will look like for re-entry into the country. And by the way, that took up about 3 or 4 hours of our meeting yesterday. So I want the country to be aware, and Jamaicans all over to be aware, that your government is looking at all the combinations and permutations of policies and programs and plans to make sure that we come up with the right set of policies. Additionally, the government of Jamaica, on the advice of the Ministry of Health, will extend the quarantine of the Corn Peace community for a further 14 days. And it is clear why this is necessary. We definitely have to ensure that there is containment in that area. As it relates to the stay-in-place orders that have been given, people refer to them as the curfew orders that have been given. Let me say that I'm generally satisfied with how Jamaicans have responded. And I think all Jamaicans should have a sense of pride in how we have responded. Just that one act of staying home at night, when maybe we should all be staying home anyway, but that one act would have slowed transmission. And for those who would want to violate, for those who would want to show hubris that they can flout the law, the state of Jamaica is going to show with deliberateness that we can enforce our laws, and that we will do it justly and with respect even for the lawbreaker. And I believe that that is what has been demonstrated in these past few days. And in that regard, we wish to announce some further exemptions, modifications to the stay-in-place orders that have been given. We understand that INDECOM has asked that they be exempted, and we have agreed with that request. We see that it could be useful to ensure that citizens are protected and that policemen are protected as well, because the objective of INDECOM is to ensure that there is transparency in the dispensation of enforcement. We're also going to exempt the Cabinet Office for obvious reasons, and the Solicitor General's Office for obvious reasons, because they support the Cabinet Office in the preparation of these orders, which we spend a great deal of time deliberating, and the probability is that we would probably go past the time set for the curfew stay-in-place order to begin. We'll also make another modification to the stay-in-place orders. The police have reported that they are having some challenges with gas stations that are remaining open. Under the current orders, it is possible for gas stations to remain open, but they are now being used as a gathering place and a potential launching pad for any form of disorder. It really distracts the police because they now have to be focusing on gas stations when they should be focusing on other areas. And therefore, the truth is that after 8, there should really be no need for the gas station to be opened. And in any event, given the circumstances and the notice already given, persons should make arrangements to fill up their tanks before 8. So, and of course, you're not driving out the gas in the night, so you should have gas in your tank in the morning. So, we are now going to specifically prohibit the opening of gas stations starting tonight at 8 p.m. So it's a short notice, but having regard to the request from the police and the challenges they face, I think it is prudent to do so. And having said that, I don't want the criminals to believe that we have forgotten about them. The truth is that we are still monitoring criminal activity very closely. And having to take on the administration and enforcement of these stay-at-home orders, it does stretch the resources of the police, which is why we have to be very careful how we put these orders in place. But I wish to, I'm not giving any warning to any criminal, but I'm going to be very clear that we are still targeting the criminals, we are still conducting the necessary operations, and we are still interdicting and arresting criminals during this period of time. Ladies and gentlemen, I'm going to break and invite the Minister of Finance to give us an update on the CARE program.
Thank you, Prime Minister. By way of background, the CARE program is a $10 billion program that involves the temporary transfer of cash to individuals and businesses to help cushion the economic impact of the COVID-19 pandemic. We will have detailed information on the program by way of a brochure that will be included in newspapers on Sunday. And this brochure on the CARE program will also be available on social media for Jamaicans to peruse and to view and to read. The mechanisms by which the delivery of these benefits to Jamaicans will occur, those mechanisms don't exist at present and have to be built, have to be constructed. And we have a team of dedicated Jamaicans from the Ministry of Finance, from the Accountant General's Department, from Taxation Jamaica, and from eGov, who have been working day and night. They've had to get an exemption on the curfew order to be able to put these systems in place to facilitate the applications that will be made by Jamaicans. The applications will open on April 9th, which is next week, and all applications will be made online through your computer or through your mobile phone. Persons will be required to submit information that identifies them, their name, their address, their phone number, their TRN, etc., as well as information about their bank account, and payments will be made automatically to the bank accounts once those bank accounts have been verified and validated. For those who don't possess bank accounts, there will be an option for them to suggest a remittance company of their choice to where the funds could be directed, and for them to collect those funds on production of an identification that matches the TRN of the application. The range of benefits are described in detail in the brochure, and we're going to make sure that we have a communication plan around these benefits so that all Jamaicans know what the benefits are and what persons can qualify for. Just to repeat, the program is geared towards the vulnerable population among individuals and the vulnerable among businesses that are affected by COVID-19. We do make for businesses that are in the tourism sector, we are aiming to have the program incentivize employers to keep their employees connected with their business, even if those employees are not coming to work, so that when the time comes to restart, Jamaica's recovery can be with the kind of momentum that puts us ahead of the rest of the region. And although we have this segment that's targeted towards tourism, I'll just remind that we have a segment that is targeted towards all small businesses in Jamaica who can qualify once they've paid their taxes and they have employees qualify for a one-time grant. And there'll be categories to which persons who perform functions that are normally registered by a municipality, and here I think about barbers and hairdressers and beauty therapists and cosmetologists and persons, bar owners and nightclub owners or operators, as well as persons who are registered with the Transport Authority, PPV licensees, and those who are registered with TPDCO, JUTA, MAXI, and JCAL, to be able to benefit from the program. Now, we are continuing, the COVID pandemic is one that is evolving rapidly, and the economic impact of it as well is evolving rapidly. And so we're in dialogue with a number of entities. We are in conversation, for example, with the representatives of the Household Workers Association of Jamaica, where we'll be making specific provisions for persons under certain circumstances and so forth. I encourage you to get your copy of the brochure when it comes out, either the physical one on Sunday or the electronic one that will come out afterwards. The website will be open. There'll be a placeholder on the website until the 9th of April. And on the 9th of April, once you have your identifying information, you can put it in. We'll have a category of benefit called just a compassionate grant, to which any Jamaican can apply as long as that Jamaican is not formally employed and is not receiving a benefit from any other component of the CARE program. So that is going to be a part of the benefit package of the CARE program that's open and available to a large pool of Jamaicans who might be unemployed, who might be informally employed, and so forth. As I said, further details are going to be coming out over the next few days, and just ask for you to share the information as it comes out with your fellow Jamaicans and help us to make this a successful intervention to assist Jamaicans with the economic support during this time of the COVID pandemic. Thanks, Prime Minister. Yeah.
Thank you, Minister. Just to reinforce what Minister Clark has said, the government of Jamaica is demonstrating that it truly cares about its citizens. We recognize that in this time of crisis, all industries are affected, and therefore the labor force will be affected, both the formal and the informal. We don't intend to create an obstacle to anyone from receiving the benefits that we have provided, and we recognize that there are those in the informal sector who would not necessarily always meet the identification requirement that would be necessary to access the benefit. And we have, as a cabinet, struggled with this, and we have considered that it is important that at this time that persons get the benefit. So you have some time. We will start open up the applications process by the 9th, is it, Minister? The 9th of April. My advice would be to everyone at this stage, get an ID if you don't have one. Get registered in some database so that we know of you. Because as we sit in the cabinet trying to figure out how are we going to help the barber who we have no knowledge of him? How are we going to help the igler in the market? We have no knowledge of her. It is very difficult to even estimate, because even the funds that we have set aside, we are not certain what are the actual numbers of persons. We have some certainty for those who are employed. We have some certainty for those who are compliant. But for others, we simply just do not know. And it makes it very difficult for government to plan, for government to make budgets. Now people say you have a census. Unfortunately, the last census was over 10 years ago. So we definitely need to have an understanding. Of course, we do updates, we do checks, we have formulas that we use, but you will never know. You will never know until you can individually identify all your citizens. So again, I have to use this platform to appeal to every single Jamaican to come into the formal system, come into the formal economy, so that we can all survive this thing together. I want to just make another point. The Minister of Finance has not made it, but it should be made. This money is not free money. And there is a sense where the population feels that the government has some money somewhere that it puts down. The government has no money. The government is the steward of your money. This is your taxpayers' money. And the government that you have elected has taken a decision, I believe, in your favor to provide some support for you during this difficult period to help to tide you over. It is a support. You would want to know that there are mechanisms in place that when we transfer the money, that we are giving it to legitimately deserving persons and to persons who are not ghosts, but real people that are getting the funds. So I wish to assure the public that the minister is being doubly careful in putting in place mechanisms to ensure that we can establish the veracity of applications and claims that are made, and that we can have at least a standard of identification to ensure that there are genuine persons actually receiving the resources. And I wish also to say that there are those who may be waiting in the wings to say that, the funds will be used in a political way. Absolutely no such thing. Absolutely no such thing. That we will put in place systems and measures to ensure that every Jamaican who follows the rules and the systems in place will be able to benefit. Now is not the time for that. Now is the time for us as a state to show that regardless of your color, race, class, creed, political affiliation, one Jamaica in a strong unity together, working to ensure that as a country, as a family, as a unit, we overcome this crisis. I want to invite the Minister of Local Government to give an update on some local government matters.
Thank you, Prime Minister. Good evening, ladies and gentlemen. Just to report that we have completed the first phase of a sanitization and cleaning program of all our infirmaries and golden age homes across the country. We employed 100 additional temporary workers to maintain the cleaning program in the facilities, and this will be accommodated over the next 8 weeks. Additionally, we have installed all the mechanisms and washing and sanitizing facilities. We have put in the necessary infrastructure to ensure that the 1,700 residents in our infirmaries and golden age homes are kept in excellent condition. We have started the program to ensure that all persons, as we had said before, visiting the facilities go through the necessary checks and balances to ensure that they are in good health, and we still maintain the restrictions on visits and admissions to our infirmaries and homes over the period. On Sunday, we commenced the all-island feeding program of the homeless communities through the length and breadth of Jamaica. And Prime Minister and colleagues, I want to advise you that so far we have provided breakfast and lunch for 10,000 such persons across the country, with the majority of those cases being in the corporate area. We are over 4,500 such persons in the corporate area have benefited from this. The ministry have also rolled out the program to take care of the outdoor poor, and I must say that within the first week of this program, we have reached some 22,000 Jamaicans who are registered as outdoor poor, including the 1,700 in our infirmaries. Colleagues, Jamaica, we have started the program to find shelter. And this is something that is of real concern, because since the imposition of a nightly curfew, we have discovered that there are many Jamaicans that was not counted in the numbers of persons that are homeless have now turned up on the streets. We have provided 100 bed solutions at a location on Church Street, which we activated last night. And this facility, as I said before, will facilitate 100 such persons, and also the Mary Atkins facility, which is running out of space. And Prime Minister, there is a need for us to pay some serious attention to this population. We have had roaming teams on the road, driving across the corporate area and to all the parishes where we find these persons. We take them to the facilities, provide them with a bath, food, change of clothes, medical checkup. So we are, in fact, doing all that we can. Just quickly, Prime Minister and colleagues, the new market regulations have been working. We are watching to see what is taking place in terms of the efforts to try to get this social distancing within the markets. We know it's going to be difficult, but we are working on it. We are working closely with the Ministry of Health and the Social Development Commission to set out the protocol around how our markets are operating. The markets have installed hand sanitizers, washing basins across all the markets, and by now, all markets across the country would have gone through a total sanitization program. So we are watching to see what is taking place within our markets. I want to also announce that the Ministry of Local Government have provided some $50 million to the local authorities for the trucking of water to all municipalities across the country, and this program is ongoing. Just 2 areas of concern. We still recognize that there are persons within the barbers and hairdressers that is not complying with the request that was made in terms of their operations, and we are still seeing where gyms are operating also outside of the request that was made previously. Let me say to these entities that we are still monitoring your activities, and if needs be, I will therefore make the request to the Prime Minister that we take more drastic steps to get compliance in these areas. Thank you.
Thank you, Minister. The government has been getting not necessarily requests, but persons seeking an understanding of government's position on the wearing of masks. And I'm going to invite the CMO to give us her guidance on this matter.
Thank you, Prime Minister, and good evening, everyone. The Ministry of Health recommends the use of personal protective equipment by healthcare personnel. Our immediate priority is to secure personal protective equipment for health workers who are exposed by close contact with persons who are ill. Close contact means that health workers are within the 6 feet distance from their patients, and the wearing of personal protective equipment protects them from exposure. They cannot avoid close contact in order to care for patients, and that is why personal protective equipment are a must. The proper use of personal protective equipment by the health worker reduces the risk from high risk to no risk, even in environments of highest possible exposure. But even the highest trained healthcare worker has to be trained repeatedly in the donning and doffing of personal protective equipment. And the area where there is one of the greatest risk of infection is in the removal of a contaminated mask. The general public is encouraged to avoid close contact with possibly infected persons by several measures, including stay at home, avoid crowded situations, and avoid ill persons. Now, many persons are advocating for the routine wearing of masks by the general public. And yes, we agree that it can be helpful. It does offer some protection, especially where there are persons who are coughing and sneezing within your 3 to 6 feet personal space. It is not totally harmless, however, and the public must be cautious. Wearing a mask continuously is uncomfortable, and you must avoid touching and adjusting the mask, as if the mask is contaminated, you will contaminate your hands and infect yourselves and others. Perform hand hygiene every time you touch the mask. As soon as there is contamination of the mask, it must be discarded, as the risk gets higher of you contaminating yourself. If the mask is not worn properly, it will go up into your eyes. Do not rub or touch your eyes after touching the mask. Again, hand sanitize after touching the mask. Discard the mask if it becomes soiled or moist. This increases your risk of infecting yourself and others. You may be taking germs on the mask into several different settings and increasing the risk of transmission. Remove the mask by grasping the loops that are either at the back of your head or behind your ears and pulling forward and away from your face. Do not touch the front of the mask. The Ministry of Health and Wellness recommends the use of masks by persons who are ill with coughing and sneezing, persons who are quarantined or isolated at home with or without respiratory symptoms, and household members who care for the person or are in the same house. Persons who have COVID-19 and have been discharged from hospital should wear a mask for 2 weeks after they have been released and exercise infection protection control measures to safeguard family members. Persons who are at high risk of developing severe illness and complications of illnesses, such as the elderly and persons with chronic illnesses. These persons must avoid ill persons and minimize contact with the public. All other considerations are at the public's discretion. The wearing of the mask must be in addition to other infection control measures, such as regular hand washing and hand sanitizing, covering coughs and sneezes, and avoid touching your faces and avoid contact with ill persons. Thank you.
CMO, after that, I will have to think twice. I came prepared with my mask, CMO, but I'm going to consider it as to whether or not I will be able to actually be disciplined in putting on and taking off the mask. So what I take away from what you have said, CMO, and I'm now not trying to speak as a medical or a health professional, I'm just trying to interpret what you have said for the persons listening, is that a facial barrier can be helpful, whether it is a medical type mask like an N95, or maybe something like this, or probably something like this. It's a pretty nice looking mask. However, there are risks associated with them, and they are not substitutes for good practices that we have been saying. Washing the hands with soap and water. If you don't have, then sanitize. If you have to cough or sneeze, then the bend of your elbow is best, and don't touch anyone else afterwards. Maintaining your social distance. All of that is good. This would be in addition to. But the mask is a surface. And particularly in a situation where it is blocking the particles from coming in, they will rest on the surface. And like any other surface, the virus will live on it. So you have to be careful in, as you say, ducking. That's the term? Duffing. Duffing, that is taking it off. So you can't hold the mask like this to take it off. You should take it off from here, or from here, or on top, from here. Oh, just from here. So if it were like this, you would take it off from that. Good. So I didn't hear you say do not wear masks. If you're going to make that personal decision, then you should firstly seek not to deprive the medical professionals who would need the mask. That's number one. So if you don't need to, then don't. If you are ill, then you should. If you are caring for someone who is ill, then you should. If you are recovered from the illness, then at least for 14 days you should be very careful and wear. Are there any other circumstances? And for the vulnerable population, in addition to your regular hygiene routine. But outside of that, it's your personal choice, bearing in mind the guidance that we have given. I believe we have covered everything. Is there anyone who would want to say anything? Oh, by the way, these are some masks that are made by our Hope volunteers, helping our people excel, and they are going to be making a few of them. Well, you're going to be making several hundreds of them, thousands of them maybe, to available for persons who would want it, particularly some of our vulnerable persons. So, ladies and gentlemen, thank you, and we're open for questions.
Thank you so much, Mr. Prime Minister, for the comprehensive briefing. We now ask members of the media, and I believe it's about 30 persons who are in the Zoom
30.
to yes.
Remember, we have a curfew.
To yes indicate by using the raise hand feature on the Zoom. If you have a question, we ask that once we identify your media entity, then of course you identify yourself and ask your question. And for those who are in the waiting, can we ask that you just put on mute so that we don't have an overlap of the audio coming out on the one that's on. The observer is first. Mr. Henry? Go ahead, Balfour. All right, let's see if we can get over then to the Gleaner. I believe Damien Mitchell. Damien, unmute your mic for us.
Sorry, you have muted me.
All right,
yeah,
there you go. We hear you.
This probably may be best for the CMO. I'm trying to find out how many health workers are still in quarantine.
The CMO is on her way to the microphone.
No, it's not there. I don't have the exact number of health workers that are on quarantine. What I would want to say to remind us that for health workers who have possible exposures, they go through a process of risk assessment. If they are determined to be at high risk for exposure, then they would be put into quarantine. If they are determined to be at low risk, then they will be monitored and they are able to work under monitored conditions. What we can report to the public is that we have in our testing, we have tested almost 9 to 10% of the persons that have been tested have been health workers. We have tested about 51 health workers for COVID, and only one that has been previously reported as positive is positive.
Thank you so much, CMO. Let's move on to Nationwide. That's Brittany. Yes, go ahead with the question.
Thank you. All right, so I have two questions. The first one, I know that the Ministry of Health and Wellness has an active mental health unit. So given the unfortunate reality of discrimination or stigma, is mental health counseling from the ministry a part of the reintegration process for recovered patients and their families? And my second question is, what is the ministry's official position on community spread? Is there enough data to suggest that it has started or that we are close to it starting? Thank you.
Thank you, Brittany. CMO is on her way.
With regards to community spread, I think that the actual definition of community spread would mean that we would have had to be seeing several clusters, and that we would have to be seeing several cases that are popping up in the communities. Now, we are monitoring about 4 or 5 clusters of infection at this time. We have not really had any new clusters. What we have been finding is more cases that are associated with the clusters that we are monitoring closely. We do have one particular case that we have under investigation that has come up through our influenza-like illness surveillance. And so therefore, the health workers are in that area doing careful monitoring of the situation. I would say that we would not definitely say that we are in community transmission at this point in time, but the situation is such that at any minute the surveillance. We're doing a lot more surveillance now of the communities from all the health centers and all the hospitals. And so at any minute we can find that we are picking up cases that are just popping up in the community without any direct link to an imported case or a confirmed case of COVID. So I think this time in the outbreak is a very pregnant time, when anything can happen. And so we are really very cautious at this time, and this is why there is just so much importance being stressed in terms of staying at home and monitoring yourselves at home and reporting to the Ministry of Health what is happening to you, because this is a very, very, very cautious time in this outbreak, because at this time 1 minute we can be going well, and then, we can just have a sudden increase. In terms of mental health, yes, right from the beginning, we have involved our mental health team in developing interventions in terms of how it is that we manage patients with COVID, in terms of how we manage our health workers who are treating patients, and how it is that we address the communities. So we actually have brochures that are out on maintaining your emotional health during this time. And the mental health team is actually doing several outreach programs. So this is an area that we're also working with other health groups, especially there are several agencies, especially like the Red Cross, that are waiting to be engaged to actively go into the communities to help with the mental health issues. So yes, this is something that we're actively looking at.
Thank you, CMO. Let's move over then to JNN, Michael Sharp.
Mr. Prime Minister, so I can't help but thinking that despite our best efforts, if the United States and the United Kingdom in particular do not get their act together, it doesn't matter what we do here in terms of keeping it right so we can open up back the country.
I didn't hear the first part of your question, but I suspect you're asking for my perspective.
Yes. Yes.
So I share the perspective that our major trading partners and our long-standing friends, the United States, the United Kingdom, to a lesser extent Canada, but all our friends around the world, that the ability for the world economy to resume really depends on how quickly these major economies get the epidemic under control. I'm fairly optimistic that these economies have the wherewithal, both from the financial and economic resources, but more so the technical and scientific resources, to bring it under control. They will go through a spike, and the spike may last for a few weeks, but they will eventually get it under control. As I indicated earlier, we are already preparing for that time. Now, even if they do get it under control, it is not likely that you will see the elimination of the virus from our population. What you will probably see is it will be continuing, but at a probably low infectious level until you have a vaccine that is in place, and that if that vaccine works effectively. But until then, we have to figure out what will be our new normal of operation. We cannot shut down the economy, and we cannot maintain these tight restrictions for a very long time. You will end up with a situation in which, as someone described it, the medicine being worse than the disease. So we have to manage this very carefully so that we don't have an uncontrolled outbreak, because that in itself would destroy the economy. And then we have to ensure that whatever outbreak there is, it is within our capacity to address it from a medical perspective. And then we have to find that sweet spot as to how we maintain that level and at the same time bring online the economy. We won't be able to come online fully because we rely on our trading partners themselves to be online fully, particularly for tourism. And that will take some time. But again, I'm optimistic that we can use this time of the epidemic, of the crisis, to find opportunities for which we can have our manufacturers and our farmers starting to produce so that when we come out of this crisis, we are in a stronger position, increasing our output, particularly in agriculture and in some areas of manufacturing.
Thank you, Mr. Prime Minister. Let's go back to Balfour. Henry, I believe his technical problems are solved. Balfour? Wonderful. Can you ask your question? We are seeing you. Have you unmuted your mic? I don't believe we're hearing Balfour again. I know Dashan Hendricks was on. He says he has some technical problems.
Are you hearing me now?
We're hearing you now, Balfour. Go ahead with your question.
Yeah, I just wanted to ask the Prime Minister if he had given any consideration to a state of emergency instead of an island-wide curfew before he made his decision.
So, as the Attorney General had indicated, that the Cabinet considered all options available, and we considered all the constitutionality questions, all of those issues. And I think where we are now, the measures that we have put in place are sufficient. As I've said, and we keep saying, that if the situation gets worse, then you should be able to have some other tools in your toolkit that you can deploy. But where we are now, I think we are sufficient.
Thank you, Mr. Prime Minister. I know Dashan Hendricks was on the Zoom. He said he had a little bit of technical problem on his side. So he sent his question. He asked, how many ventilators do we have in Jamaica? How many are on order? And when do we expect them to come into the island? That's Dashan Hendricks from TVJ.
I'm going to ask the CMO, who gave an explanation of this yesterday, but it's important to say it again.
All right, so within our normal cadre of ventilators, we have 26 across the island that are in good working condition. In addition, that does not include the University of the West Indies, where I understand that they have 28 ventilators there. In addition to that, we have obtained 3 ventilators last week. We received a further 23 last night, and we are to receive a further 7 next week, and then 25 at the beginning of May. That would take us up to 80 that we would have by about the first week of May. No, that's 80 including 26 plus 28. Yeah.
All right.
Thank you, CMO. Before we go to the other questions, I actually, the Minister of Foreign Affairs had an update which would have answered all these questions, many of them about where we are with donations and international philanthropy and our partners. I'll invite the Minister of Foreign Affairs to give a brief report on that.
Thank you, Prime Minister. And I would just remind the public that the update is in the context of the mandate given to me to establish an interministerial mechanism, which we have called the External Support Coordination Committee. Its intention is to ensure coherence in the engagement with our external partners, to ensure coherence in communication between the ministries, departments, and agencies, and as between them and our external partners, to ensure that offers of assistance meet our priority needs at this point in time and to ensure that gaps are covered, as well as to devise methods of accountability and transparency with regards to assistance given during this crisis. So the committee includes the Ministry of Health and Wellness, Finance and Planning, Education, Youth and Information, Labor and Social Security, Transport and Mining, Local Government and Community Development, as well as the key agencies, the PIOJ, the NHF, and the Health and Wellness Foundation. From this core, we reach out to other agencies as well and ministries as required. The committee has met 3 times primarily by video conference, in addition to the interagency meetings that are held to underline the actions which are necessary. So a priority needs list was provided by the Ministry of Health, and this has continued to work and to be sub-prioritized and has been provided to our external partners. And this has allowed us to align resources as we move along and to try to coordinate how best to ensure we get donations where it is possible to fill needs versus procurement to also ensure that we are moving with time and capacity as needed. So, for example, the 29 of the ventilators referred to by the CMO just now are being provided under support by the European Union. And the European Union is not only providing these 29 ventilators, which include transport ventilators and the priority ICU ventilators, but they are also exploring how to pull together additional funding to support other priority needs, which may include ventilators if we don't procure them from other means or other related equipment. You may also have heard that the Republic of South Korea, together with East-West Power, will be providing test kits, and they will be sufficient to test 7,500 persons. And these are intended to be shipped on the 8th and to arrive on the 15th, all things remaining equal, because we remember, of course, that we're having challenges with logistics and global shipping generally. But this is the intention at this point in time. They're also providing supporting equipment, which will allow for implementation as well as training for technical personnel. We also are looking forward to receiving from the International Atomic Energy Agency another body of kits which should be sufficient to test 2,000 persons, and this is in conjunction with support from the United States and Canada, United States and Canada, which provided COVID emergency funding to the agency, such that they are now going to be meeting this particular need, this particular priority for Jamaica. We're also receiving an initial shipment from the government of the People's Republic of China, which includes N95 masks, disposable protective clothing, infrared thermometers, protective goggles, disposable surgical gloves, medical isolation shoe covers, and we're also receiving from private sector companies within China to include 30,000 masks, gloves, eye protectors, more protective suits, and you may have heard or seen a response, or rather a notice in the public also about a specific donation from Jack Ma and the Alibaba Foundation. Those are not included. There is also, although it has not shipped yet, but we are looking forward to welcoming it, 30,000 surgical masks and test kits for 3,000 persons. And I speak in that language because the CMO I know has explained to you before that some tests require 2 stages, so the number may be higher, but so I speak in the number of persons who will be covered. And we also have received at the embassy in Beijing from the Hubei People's Association for Friendship with Foreign Countries 10,000 masks, which we will be sending by diplomatic bag so that they'll get here a bit more quickly. We know, of course, that there are other donations which will come through the United Nations, through PAHO and other agencies. UNICEF, as you would know, is already working directly with the Ministry of Education, Youth and Information. And of course, you would have heard, which didn't come through this committee, but we will now work to support implementation with the Ministry of Health, USAID, as well as PAHO, to implement the 700,000 US or $95 million J donation by the government of the United States through USAID. because that is going to be deployed into the COVID response, but it will now come through the committee to help support how it is implemented. So as you can see, there's quite a bit happening on the international partnership platform, recognizing that even though these countries are having their own challenges, they are reaching out. We are working with them. We continue to express our sympathies and our solidarity with their governments and people as they continue to work through their own domestic challenges. And we express continuously our appreciation for the support and partnership which they also extend to us. And if you would just permit me, Prime Minister, just one more, but although I know that it is in the public domain already, the government of Cuba has also been an excellent partner. You would know already that they have provided 140 healthcare workers who are in quarantine, but some, I understand, are to hit the ground running very soon. I'm sure Minister of Health will speak about that. But so that did not come through this committee, but I feel it would be remiss of me to not express appreciation as well to the support being given in terms of that human capacity. So thank you, Prime Minister, and once again, thank you to our friends and partners.
Thank you, Minister. Prime Minister?
Thank you. Very important that we acknowledge the assistance that we have been given from our international friends, international partners. Even in a time of crisis, the goodwill for Jamaica still is strong. And, when people are kind, we should say thanks. And I use this opportunity to thank all those who have reached out to us and assisted. The CMO has asked me to clarify a point, just so that the public is aware that we should have 80 ventilators by next week. In total, we should have 80. And then by the 1st of May, thereabout, another 25 should come into the island. So we should have, by the 1st of May, thereabout, over 105 ventilators in terms of our capacity. And that's critical to understand. We will continue to build out capacity as needed, but I would not want anyone to be panicking. We have made provisions, and those provisions are coming into place nicely. We could return to questions. Thank you, Minister, for that update.
Thank you, Prime Minister. I do believe it's 23 minutes past 6. We'll take about a few more minutes of questions. Quickly, though, from social media, given that the Minister just spoke, there's a Latonia on social media who's asking, will the government offer some form of relief for those who may be violating their visas, or if it's at risk, given this public health crisis globally?
I suspect you mean
on both sides.
Jamaicans who are overseas.
Correct.
Thanks very much. Of course, the advice would vary depending on where you are in the world. We know, for example, that the European Union has just this week announced that they will not be enforcing on persons. They will be allowing extensions for persons who are legitimately working or staying and who will be unable to travel or travel before the expiration of their visa for reasons related to travel restrictions. We also are aware, I just received it, I believe, yesterday, that the USIS has issued an official request now that persons who may be similarly affected there, that they should apply to the U.S. immigration for an extension of stay, and that it's important that they do this before their visa expires. So if you are legitimately there, then you can seek an extension. So keep any receipts you have, any plane tickets, itinerary that you had to demonstrate that you were planning to move, rather to return home. And also, if you're having a challenge or if you're uncertain how to proceed, please get in contact with our missions. The emergency contact information is up on the website, mfaft.gov.jm, or it's on our social media platforms, Facebook, MFAFT, or you can email the embassy at consul@jamaicaembassy.org. Easier probably to just remember mfaft.gov.jm.
Thank you, Minister. Prime Minister, another question for you. Would you be able to update public sector workers or non-essential workers who are mandated to stay home if there's also an extension? And is there any consideration for asthma patients to be mandated to stay home, just like the elderly are?
Well, as it relates to the asthma patients, that question keeps coming up. I suspect that you would want to consider them a vulnerable group. CMO, you'd want to take that question. We have not made any specific orders for asthma patients, but maybe it is something that we should consider for them to.
Sorry, Prime Minister, I'm not the clinician, but since the CMO is also an asthma patient, I'm speaking on her behalf. Yes, they are a vulnerable group. We have discussed it because she's also having to protect herself from any possible risk. But any individual with an underlying condition, diabetes, hypertension, lupus, asthma, anything that could compromise their immune system would be at risk, and as a consequence should be particularly careful.
So again, we haven't made any specific order for asthma, but it is part of the vulnerable group, and therefore they should take the necessary precautions.
And as a consequence,
as it relates to the work from home orders that have been given, those haven't come to an end somewhere about the 7th of April. We are in the process of reviewing, and we will come to a decision on that. We'll probably alert the nation to that on Monday. But I suspect from what I'm seeing now that it is likely that it will be extended. And people might be wondering, what would be the trigger for some of these orders to be revoked? Well, the CMO used a term which I found very interesting. This is a pregnant time. It is meaning that it is a time when there is an expectation of something to happen, and it is, it will materialize. So as Minister Mackenzie is saying, there's no such thing as a little bit pregnant. But the truth is that we are very close to the community spread stage. We have been explaining this to the public, and the fairly gradual rise in our curve may give people a false sense that we are okay. We are very far from being out of the woods. At 23 days into the crisis, if we could get the graphs up, we are very early into the crisis. Yes, we have managed to keep the curve flat, which keeps us in good standing. But if we release these measures too early, that curve could spike. If we could get graph number 1. So just looking at that graph by itself doesn't show you relative to other countries, but that's that's how the cases, the new cases have come in, and the orange line shows you the cumulative cases. We are now at 53, it is, Minister, 53 cases. 53 cases. The blue lines show you the new cases. So we had 6 new cases today. The purple line shows you the deaths that have occurred. We have had 2 so far. And the yellow line shows recovery. My graph is saying 3. We are really at 7 in total now, which is good. And so that is an overview of where we are. If we go to the next graph very quickly, we still pay close attention to the debates and concerns about testing. I wish to say that I have supreme confidence in the testing protocols established by the Ministry of Health. The logics seem quite reasonable to me, and I believe that we are covering all our bases. We are expanding testing, however, and those testing will be, again, along what I would consider to be smart lines. So we are going to be ensuring that we expand the testing and that we increase coverage. But again, we're not going to go in a way in which we are wasting resources. So it's a very strategic way in which we are going. I think we have progressed very nicely, as you can see from the graph. The blue lines, the blue lines, the blue bars represent the tests done on a daily basis. And you can see, starting from the first test case to today, that we have significantly increased. We are now at 539 tests. We did 64 tests today, or yesterday, of which 6, the red part of the bar, represents the number of tests that are confirmed positive. If you go to the next slide, this is a very interesting graph because it shows, the blue line shows how tests are increasing over the period of the 23 days, and the orange line shows the number of positives that we have yielded from the tests. So you can see that we are increasing our tests rapidly, but there is a fairly flat line. There are some who will say that flat line is because you're not testing enough. But we will increase the number of tests, and we will see what that will do to the yield of positive tests. Next. It's a very interesting graph. It is therefore a statistical explanation, not so much for a data explanation. The red line shows where we are actually. And you can see that the red line tracks very closely the green line. The green line is linear, meaning that it is a fairly flat rate of increase. The blue line is exponential, meaning that it is increasing at an ever-increasing rate, at a constant rate probably of what it was the last time. And therefore, it will rise much faster. What we're trying to do from a strategy perspective is to keep on a linear scale rather than on an exponential scale. If we go to the next graph, we are fairly much now on a linear scale, though it's still very early, I must say that. At 23 days in it is very difficult to do a best fit line for this data based upon how much more of the epidemic we project to come. But presently, we seem to be somewhere around an 8-day doubling of the numbers. That's what the CMO has posited from the best information that we have. And an 8-day doubling places us on a relatively flat curve that would probably match a more linear growth in the numbers. However, if there is some unknown occurrence in the population, what could that unknown occurrence be? Persons who came into the island that we have no knowledge of their health status because they have not reported, and they are ill, and they are infectious, and even if they recover, they could still be shedding. And even before they show symptoms, they could be infecting. If those persons are moving around in the country and infecting other people, and then all of a sudden cases turn up, that you cannot connect these cases to other cases that you know about, and you start to see this in increasing numbers, then you would say that the virus is at large in the community. And that is when now we would say we have definitely community spread. That means anywhere you go, you could get the virus. That means we couldn't say that we are quarantining any area really, because it doesn't make sense, because it's all over. Then you would have to go now with a different strategy. To curb that now, that is when you would have to do what other countries have been forced to do, such as a total lockdown. So I hope people understand why it is that the government is being so strict on these other measures. Social distancing, proper hygiene, stay at home, work from home, vulnerable stay home, so that we don't get to this community spread, where really the only tool to control the community spread would be to implement a lockdown. And we have tried our best. I think we have really exercised all our energies in this regard. But it really depends on what you do personally. I visited my constituency recently, and it was a joy to see everybody, but everybody wants to come and hug me up. And, it's hard to say to people, don't, but we are going to have to bring that now into our daily practice. You have to give people social distance. Give them their space. And it's not a disrespect, it's not scorn. It's just that in this period of time, it is the responsible thing to do. I'm really nervous when I see the pictures of our markets and everybody going about their business. And I see the interviews on TV and everybody saying, nothing happened to me. Until you end up in the hospital and then we are struggling to find ventilators for you. I urge you to pay attention to what is happening in the other countries where we see patients dying and countries having to make decisions about who gets the ventilators. It is a very serious issue. So if we go back to the final graphs, so we are at 53 cases on day 24. Panama is at 1,475 cases at day 25. If people do not behave responsibly, our curve could easily shoot up. And so I end my presentation to you today. Please be socially responsible. Please, if you have come into the island after the 18th, please report to the Ministry of Health, 888-1-LOVE or jamcovid19.moh.gov.jm. Thank you, ladies and gentlemen.
Mr. Prime Minister, thank you so much. There are no further questions from our Zoom participants, and so we'd like to thank everyone for attending the briefing this evening, and we wish you a safe weekend. Please remember to stay indoors and stay safe. Good evening, everybody.
Land of wood and water. That's Jamaica, once covered with lush forests,